The South African Medical Association says there's a massive problem with the healthcare system in the country. This comes after that report into Lethole's death. We speak now to the organization's Mvuyisi Mzukwa, the vice chairperson of the South African Medical Association. It would sound like this did not come to you as a surprise. You're seeking an urgent meeting with health authorities and those involved to discuss what?
Viewers. First, let me start by relating our sincere condolences to the Shonisani's family, relatives and friends. We know that it's been a long time since last year, around June, but I'm sure this tragedy is still very fresh in their hearts, since we are relating still our condolences to them. We welcome the investigation that was launched by the health ombuds. As we correctly put it, we're not surprised. We're shocked, but not surprised. Our hearts are broken because there's a family involvement and somebody's life was lost. But this is a daily occurrence in the health system where Sama has been raising issues regarding the dysfunctionality of the system. Because if you listen to that report, firstly, it mentions that the MEC for Health, Dr. Bandile Masubu, then MEC Bandile Masubu was misled in terms of the hospital readiness for COVID-19. Secondly, you can actually see that there are leadership challenges in the hospital, which is something that we've always been raising because most of these institutions have political appointees who are really not having the required competencies. As we always say it, I mean, it was already seen in the hospital where you find cleaners refusing to get in the house because there are no PPEs. So those are the issues that we've always been highlighting, that there are challenges of leadership, and if you have problems at the leadership level, don't expect to get anything better on the ground.
The CEO for Tembisa Hospital has since come out to say that he will take the report on review, saying that some of the information contained in that report is false and misleading information. Your comment on that?
Well, I think that is a right afforded to him by our constitution. But as we already said in our statement, that we are not surprised, honestly, because this is what is happening all around in our healthcare systems. Because, I mean, what you observe there, you also observe that the doctor's notes were lost. So there's some information that is missing. I think about 6 days worth of notes are not were found to be missing. But on top of that, we find a very strange thing happening in these hospitals, where you find that clinicians are expected to do administrative work in most cases, especially when clinicians are working at night. Managers are sleeping at home. Clinicians have to decide if there are no beds, if they are, they have to make decisions, administrative decisions. But when they backfire on the clinicians. And that's what we've been complaining about, even including the shortages of staff. So, and you know that this has heavily affected our healthcare workers. We've already said that they are tired, they are exhausted, their morale is low, and there's no support. Support system has fallen apart in these institutions, like your employer assistance programs. They are dysfunctional in the state. So I'm not surprised that this is what is happening, especially in these institutions, including the private hospitals, by the way. They must not be left out of this thing, but it's happening even in that area of our society.
What hopes that this meeting will actually be fruitful? You mentioned a little bit earlier on that this is not the first time you're engaging with health authorities on this matter. You point out that this is a daily occurrence in our health system.
Our hope is that, this will be a wake-up call. I mean, I don't know how many we've had where we've been pointing out these things. I mean, you'll remember some time back, I think it was 2017 or so, where healthcare workers in KwaZulu-Natal took to the street. They had a march protesting against shortages of staff, broken equipment, all these things in the hospitals, lack of security. I mean, these are the things that we are highlighting, and we hope this time we will get attention from the minister, because this means that there's still a lot of people who are going to be, affected by this dysfunctionality. We need proper, clear plan from the minister. What is it that we must do now in terms of stopping this fragmentation of the healthcare sector? As I always said, our healthcare sector is fragmented. The minister cannot literally tell the MECs what to do, even with the monies that are given to the provinces, because they report to the premiers, and you get these MECs who are not getting proper reports from the institutions. Like we said before, that our healthcare professionals, when they make complaints, they need the attention of the minister, because when they get these reports from their managers, they get a rosy report, that says all is well. But now the signs are there, the writing is on the wall.
Thank you very much, Mvuyisi Mzugwa, the Vice Chairperson of the South African Medical Association.